Baking soda, also known as sodium bicarbonate, is a common household item often used in cooking and cleaning. However, many people over 60 are unaware that it also has several practical applications in personal health care. In this video, we'll explore 13 evidence-informed ways baking soda may support health in older adults, from digestive balance to skin hygiene and oral care. All suggestions are intended for occasional or topical use and should not replace medical advice. Let's review each potential benefit clearly and concisely. Digestive and metabolic support. Baking soda, or sodium bicarbonate, is an alkaline compound that can interact with acids in the body. One of its most well-known uses is as a short-term antacid. When mixed with water, baking soda neutralizes hydrochloric acid in the stomach, potentially providing temporary relief for conditions like heartburn or acid reflux. For older adults who frequently experience gastroesophageal reflux disease, GERD, this can be a useful non-prescription option for occasional use. However, it should not be used as a long-term solution due to the risk of altering stomach acid levels or affecting kidney function over time. A 2013 review published in Therapeutic Advances in Chronic Disease noted that sodium bicarbonate can provide rapid symptom relief in mild dyspepsia, but warned against routine use without physician oversight. The recommendation is clear: limit use to occasional cases, and always dilute properly, typically 1/4 teaspoon in a full glass of water. Baking soda may also support metabolic balance in certain conditions involving acid buildup. In people with chronic kidney disease, CKD, metabolic acidosis is a common issue. A 2009 study published in the Journal of the American Society of Nephrology found that bicarbonate supplementation slowed the decline of kidney function in patients with stage 4 CKD over a 2-year period. While this study used pharmaceutical-grade bicarbonate under medical supervision, it opened the discussion for its potential protective role in early-stage metabolic acidosis. For seniors managing mild uric acid buildup or gout flare-ups, the alkalizing effect of baking soda may also help. By increasing urine pH, it can enhance the solubility and excretion of uric acid, potentially reducing the severity of attacks. However, this benefit is not universal and should only be considered with healthcare guidance, particularly for individuals with hypertension or sodium-sensitive conditions. Linda, 72, reported occasional use of a diluted baking soda solution under her doctor's guidance to manage mild acid reflux. She noted improvement in nighttime symptoms when avoiding heavy meals and using the solution no more than twice a week. This aligns with clinical advice that emphasizes moderation and monitoring for sodium intake. Beyond internal use, baking soda is also recognized for aiding digestive comfort by reducing bloating or gas. It does so by promoting the breakdown of food residues that might otherwise ferment in the gut, particularly after meals high in fat or processed ingredients. While no large-scale clinical trials directly validate this use, its mechanical antacid properties suggest a plausible mechanism. It's also worth noting that baking soda may influence oral and esophageal health indirectly. Acid reflux, if left unchecked, can damage the enamel of teeth and irritate the throat lining. By buffering acidity, baking soda may help reduce this erosive effect, although it should not replace dental care or prescribed treatments. In summary, while baking soda is not a cure-all, it does have scientifically recognized roles in supporting digestive health when used responsibly. Older adults who experience intermittent heartburn or mild acid retention may consider it as a low-cost aid, provided they follow medical advice and use proper dosage. The key lies in moderation, awareness of sodium intake, and understanding its intended role as a short-term adjunct rather than a daily habit. Skin, oral, and hygiene applications. Baking soda is widely recognized for its topical uses in daily hygiene and personal care, especially among older adults with sensitive skin or oral tissues. Due to its mild, abrasive, and antibacterial properties, it has long been used as a cost-effective alternative to many commercial products. One of its primary applications is in oral hygiene. Brushing with a baking soda-based toothpaste or using a gentle paste made of baking soda and water may help reduce plaque buildup and surface stains. Its mildly abrasive texture assists in mechanical cleaning, while its alkaline nature helps neutralize acids in the mouth that contribute to tooth enamel erosion. A 2017 review published in the Journal of Clinical Dentistry found that toothpastes containing baking soda were significantly more effective at plaque removal compared to non-baking soda variants, without causing excessive wear when used properly. For seniors with dry mouth or who wear dentures, baking soda can also serve as a gentle mouth rinse. A diluted solution, about half a teaspoon, in a cup of water, can freshen breath and reduce bacterial load. Additionally, its soothing effect may help relieve irritation caused by minor mouth ulcers or ill-fitting dentures. This can be particularly useful in maintaining oral comfort between dental visits. Eleanor, 68, shared that after switching to a baking soda rinse twice a day, she experienced less gum sensitivity and improved breath freshness, especially during dry winter months. Her dentist approved the practice as long as she avoided excessive concentration and continued routine checkups. Beyond oral care, baking soda also plays a practical role in skin hygiene. For example, it can be used as a natural deodorant for those who experience irritation with chemical-based products. Applying a small amount of dry baking soda under the arms may help absorb moisture and reduce body odor by neutralizing acidic sweat. While it does not block sweat glands, like antiperspirants, it may be a gentler option for older adults with delicate skin. Another effective use is in soothing minor skin irritations. Adding 2 or 3 tablespoons of baking soda to a warm bath can help relieve symptoms of dry skin, eczema, or mild rashes. The alkaline solution may reduce itching and help calm inflammation. A 2000 article in Pediatric Dermatology supported its use in therapeutic baths for patients with sensitive or inflamed skin. Although the evidence remains primarily anecdotal and based on long-term clinical observation, baking soda foot soaks are also popular among older adults. Soaking the feet in warm water with 1 to 2 tablespoons of baking soda for 15 to 20 minutes may help soften calluses, neutralize odor, and reduce fungal activity in cases of mild athlete's foot. While not a substitute for antifungal treatments, this approach may support hygiene between medical appointments and enhance comfort in closed footwear. It is important to note, however, that some individuals may develop mild skin irritation when baking soda is used directly on the skin in high concentrations or over long periods. Patch testing is advised before applying it to larger areas. Additionally, those with broken or highly sensitive skin should consult a dermatologist before incorporating baking soda into their care routine. Overall, the hygienic and topical uses of baking soda offer several low-cost, accessible benefits for older adults, from maintaining oral health to easing common skin discomforts. Its versatility makes it a useful tool provided it's used correctly and with awareness of individual sensitivities. As with any self-care practice, it is recommended to discuss its use with a healthcare provider, particularly when combined with existing medical treatments or skin conditions. Inflammation, circulation, and internal balance. Beyond its external uses, baking soda has also been studied for its potential systemic effects, particularly in modulating inflammation and supporting pH balance, 2 important factors in aging and chronic disease management. A key area of interest is baking soda's ability to influence systemic inflammation. A 2018 study, published in the Journal of Immunology, investigated the effects of oral sodium bicarbonate solution on immune response in both animal and human subjects. The findings showed that a small, daily dose, approx. Teaspoon in water, promoted anti-inflammatory activity by shifting immune cells toward a regulatory profile. While this is a promising direction, researchers emphasize that these results are preliminary and not a substitute for prescribed anti-inflammatory therapies. For seniors dealing with chronic low-grade inflammation, a common component of conditions like osteoarthritis, metabolic syndrome, or autoimmune disorders, this immune-modulating effect may be of interest. However, medical supervision is essential, particularly for those with cardiovascular or renal concerns, due to the sodium content of baking soda. Another relevant benefit involves potential support for circulation and vascular health. While baking soda is not a treatment for cardiovascular disease, its alkalizing effect may indirectly assist by reducing acid load in the bloodstream. High levels of metabolic acidosis have been associated with vascular stiffness and endothelial dysfunction in older adults. A 2013 review in Current Opinion in Nephrology and Hypertension noted that correcting acidosis through bicarbonate supplementation may improve vascular tone and reduce progression of complications in patients with early renal impairment. George, 75, was advised by his physician to try a low-dose sodium bicarbonate regimen to help correct mild metabolic acidosis, identified in routine lab results. Under regular monitoring, his blood bicarbonate levels returned to the normal range within 3 months, and he reported improved energy and fewer leg cramps. This approach was strictly supervised due to his concurrent hypertension, highlighting the importance of individual risk evaluation. Baking soda has also been linked to improvements in muscular recovery and reduced fatigue during physical exertion. In sports medicine, sodium bicarbonate is sometimes used as a buffering agent to reduce lactic acid buildup during high-intensity exercise. Although not widely applied in the elderly population, this mechanism could theoretically benefit older adults engaged in moderate physical activity or rehabilitation. However, safety remains the top priority. High doses of baking soda can lead to side effects such as alkalosis, electrolyte imbalances, or increased blood pressure. The U.S. National Kidney Foundation has warned against unsupervised use in people with compromised renal function, emphasizing the need for individualized dosing and clinical oversight. Aside from systemic benefits, some practitioners propose that baking soda helps balance the body's internal pH, making it less hospitable to certain pathogens. While the human body maintains its pH within a tight range regardless of diet, local buffering such as in the stomach, kidneys, or blood plasma can still be influenced by bicarbonate intake in specific contexts. This theoretical framework continues to be debated in integrative medicine, but it should not be interpreted as a blanket detox or disease prevention strategy. In summary, while baking soda is not a cure for inflammation or circulation issues, it has demonstrated measurable physiological effects that could benefit selected seniors, particularly in managing mild acidosis or inflammatory markers under medical direction. The emphasis should remain on safety, moderation, and evidence-based application tailored to each person's medical profile. When considered carefully, baking soda may serve as a useful adjunct to more comprehensive health plans for aging adults, urinary health, detox support, and safety guidelines. In addition to its digestive and anti-inflammatory effects, baking soda may also play a role in supporting urinary health and aiding in gentle detoxification pathways. These functions are of particular relevance to older adults, especially those managing recurrent urinary tract discomfort or acid-base imbalances. One well-documented application is in urinary alkalization. Sodium bicarbonate can raise urine pH, making it less acidic. This has potential benefits in certain types of urinary tract infections, UTIs, or irritation caused by highly acidic urine. According to a clinical summary in BMJ Best Practice 2020, urinary alkalinizers like sodium bicarbonate may help relieve symptoms such as burning or urgency during urination, particularly when used as an adjunct to prescribed antibiotics, or when bacterial cultures are negative but discomfort persists. However, its use should be limited to short-term, symptom-specific cases. Extended or high-dose use without medical supervision may lead to complications such as electrolyte imbalances or increased sodium load. For some older adults, baking soda may also be used as part of a short-term reset after dietary overindulgence or medication-related digestive side effects. Although the body has efficient detoxification systems, primarily the liver and kidneys, some integrative health practitioners suggest that mild alkalinization through baking soda, water teaspoon in 200 milliliters of water, may help buffer temporary increases in systemic acidity. This approach, while not backed by large-scale clinical trials, has been used in complementary health protocols with caution. Helen, 70, shared that she uses a baking soda solution after meals rich in protein or acidic foods, especially during festive seasons when dietary habits change. Her physician advised her to monitor blood pressure and avoid use during periods of fluid retention. The result was fewer episodes of bloating and improved urinary comfort. There's also some exploration into baking soda's potential to support renal health in aging individuals with declining kidney buffering capacity. As mentioned in Part 1, a 2009 study in the Journal of the American Society of Nephrology demonstrated that bicarbonate supplementation in individuals with stage 4 chronic kidney disease helped delay the need for dialysis by reducing acid accumulation. However, this was done under strict clinical settings with controlled doses and regular blood monitoring. Seniors with even mild kidney dysfunction should never self-administer baking soda regularly without medical clearance. In terms of general detox or immune support, some proponents claim that an alkaline environment reduces oxidative stress or enhances immune cell performance. While basic science supports the importance of pH in cellular function, no peer-reviewed studies to date confirm that drinking baking soda offers systemic detoxification benefits in healthy individuals. As such, this practice should not be seen as a replacement for hydration, balanced nutrition, or appropriate medical care. It is also essential to discuss safety considerations for older adults. Because baking soda is high in sodium, about 259 milligrams per teaspoon, even modest daily use can significantly contribute to sodium intake. For seniors with high blood pressure, edema, or on sodium-restricted diets, this could worsen fluid retention or cardiovascular strain. The American Heart Association 2022 recommends limiting daily sodium intake to 500 to 300 milliliters for older adults, which leaves little margin for excess from non-dietary sources. Additionally, the combination of baking soda and acidic substances like vinegar or lemon juice may produce carbon dioxide gas and cause gastric distension. While this may be harmless in most individuals, those with gastrointestinal conditions such as hiatal hernia or reflux should avoid such combinations. In summary, while baking soda may offer temporary relief in urinary discomfort or assist in short-term pH buffering, its internal use must always be approached with caution, especially among seniors with hypertension, kidney disease, or fluid retention issues. When used correctly, in small doses, and with professional guidance, it can be a helpful part of a broader health routine. However, It is not a detox tool or preventive treatment, and overuse can lead to significant health risks. Practical household uses with health implications for seniors. While most discussions about baking soda focus on its internal or topical use, its role in household hygiene can also indirectly impact the health and quality of life for seniors. Maintaining a clean, low allergen, and low irritant environment is essential for healthy aging, especially for individuals with respiratory sensitivities or mobility challenges. Baking soda's versatility makes it a valuable, non-toxic option for supporting that goal. One of the most straightforward and beneficial uses is odor control in enclosed spaces. Baking soda's alkaline nature allows it to neutralize acidic odor compounds effectively. Sprinkling baking soda in shoes, on carpets, or inside the refrigerator helps absorb smells without relying on chemical deodorizers, many of which contain volatile organic compounds, VOCs, that can irritate airways in older adults. For seniors with chronic respiratory conditions such as asthma or COPD, reducing chemical exposures at home is a practical health strategy. The Environmental Protection Agency, EPA, and American Lung Association both recommend minimizing the use of artificial air fresheners and household cleaners containing fragrances or harsh solvents. Using baking soda for surface scrubbing, drain maintenance, or neutralizing pet or cooking odors offers a safer alternative. Another helpful use involves cleaning dentures and oral appliances. Baking soda can be used to soak dentures overnight to reduce plaque buildup and neutralize odors. Unlike some commercial cleaners that may be abrasive or contain bleach-based compounds, a diluted baking soda solution is gentler on both the prosthetic and the oral tissues. In a 2021 article from Gerodontology, researchers highlighted the benefits of simple, non-abrasive cleansing agents like baking soda for maintaining denture hygiene in institutionalized older adults. For individuals with skin sensitivities, replacing chemical-based household cleaning agents with a baking soda paste may reduce the risk of contact dermatitis. When mixed with water and a small amount of mild soap, baking soda becomes a safe surface scrub for sinks, tubs, and counters. While not antibacterial on its own, it physically removes residues and grime, lowering the microbial load through friction without introducing harsh residues. Michael, 74, who lives alone and manages his own housekeeping, uses baking soda for cleaning bathroom surfaces and deodorizing his shoes. He noted fewer skin flare-ups and breathing discomfort since removing conventional cleaners from his routine. His dermatologist supported the switch as part of a broader plan to reduce eczema triggers in his daily environment. In the kitchen, baking soda can also aid in food safety. Soaking fruits and vegetables in a solution of water and baking soda for 12-15 minutes may help remove more pesticide residues than water alone. A 2017 study, published in Journal of Agricultural and Food Chemistry, found that a baking soda solution, percent concentration, removed more surface-level pesticide residues from apples compared to tap water or bleach solution. While it does not remove systemic pesticides absorbed into the food, this step can still reduce surface contaminants and make produce safer for daily consumption. Finally, baking soda may contribute to fire safety, particularly in the kitchen. In small grease fires, pouring baking soda directly over the flame, never water, can smother the fire by releasing carbon dioxide and cutting off oxygen. While not a substitute for a fire extinguisher, this knowledge can be life-saving in urgent situations where seniors may be at greater fall or burn risk during panic. In conclusion, baking soda extends beyond personal care into the home environment, where it can help reduce exposure to chemical irritants, improve hygiene, and even enhance kitchen safety. These indirect health benefits are particularly relevant for older adults who are managing multiple sensitivities or chronic conditions. Simple substitutions using baking soda can make the home a safer and more supportive space without added cost or risk. As always, proper handling and moderation apply, especially in settings where skin contact or ingestion is possible. Baking soda is more than a household staple when used appropriately. It offers a wide range of practical benefits that may support digestion, skin health, hygiene, and even certain metabolic functions in older adults, from relieving occasional heartburn to gently cleaning dentures or freshening indoor air. These simple applications can make daily life healthier and more comfortable. However, it's important to remember that not all uses are suitable for everyone, especially when taken internally. For seniors with high blood pressure, kidney concerns, or on sodium-restricted diets, professional medical guidance is essential before using baking soda regularly. Even when used topically or in small doses, understanding personal health conditions and medication interactions should always come first. As with any self-care tool, responsible use and moderation are key. If you found this video helpful, please click like to support our content and subscribe to Radiant Health 60 for more reliable, senior-focused health insights. We publish weekly content designed to help you age with confidence, clarity, and better knowledge. Have you used baking soda for any of the reasons discussed today? Let us know in the comments below. Your experience might help someone else. And if you have questions about a specific use, we encourage you to discuss it with your healthcare provider. Thank you for watching, and we'll see you in the next video.